Good morning, everyone. We are now kicking off the 29th edition of the SSPH Plus Lugano Summer School. This is our 29th edition of the summer school, as I just said, but it is our first edition ever to be online. And I am really thrilled that you are joining us today. Today we have 105 people on the call on Zoom, and we have others watching on YouTube. We also have 149 participants joining the Lugano Summer School from 34 countries this week. We're coming to you, of course, instead of you coming to Lugano. At this monumental moment, I think it's incredibly important that we meet here as a School of Public Health. We also have some other exciting activities happening, and that includes Switzerland is celebrating 100 years of public health tradition this year in Switzerland, and also the Swiss School of Public Health turns 15. I can think of no one better able to talk about the intersection of COVID-19, public health in Switzerland, and public health globally than Marcel Tanner. So with that, I'd like to turn it over to you, dear Marcel, to greet us and share with us your insights about COVID public health, the public health Swiss response, as well as the global response. Thanks, Marcel. Over to you.
Thank you very much, Susan. Thank you very much, everybody. Good morning or good afternoon, where you are in the world, or good night on the other hand. But it's a real pleasure to talk to you. And I don't see you all, but it's a real pleasure to be present here. And I thank very much the Swiss School of Public Health, all involved that invited me to talk as on this very important occasion. I mean, it's the topic I was given, Swiss School of Public Health, 15 years. At that time, it was not yet 100 years of public health in Switzerland. And then COVID, and then the public health as a whole, as well as the Swiss and the global response. As you can imagine, this is not the easiest thing in the world to tackle all this. So you always ask the question, if you have to do that, how do you do this? And how do you actually really bring these elements together? So what I did, and with all the wonderful memories to Lugano, and initially we had the school at the Monte Verita in Ascona, on the other side of a small mountain here, I actually went back and asked the question, what did we say at that time in a way of what should be a public health strategy for Switzerland, particularly also in the topics to address through science? And I do this now by taking some old slides which I have presented in plenary lectures 10 years ago. And actually I ask you, and this is your small job instead of just listening, when I talk about these issues and I roll through this story of these 15 years, and for us, for many of us, many years before in public health, to think about what or how relevant or irrelevant this whole thing is, what we face nowadays with the COVID. I didn't want just to have a COVID presentation about Switzerland and what we did, and from lockdown, things that you have read and seen many, many times from many, many countries. I've tried to take the approach where public health in the center and where we went through. So the issue starts actually here. This is a picture of in Lugano, how we actually should be at the moment. That's what we should do now. We should be together, and we should really enjoy working together, sharing together. And this is how we have always had this summer school as a focal point for sharing and mutual learning. So this picture, the date is unimportant, but you see different nations representing different systems, sharing and comparing in groups and in lectures. 15 years anniversary, it pops up. This is actually a little bit the sentimentality. Basically, we should have now the moment to celebrate this and to not only show the cake and the bottle, but open it. And then comes the question, of course, happy anniversary. What are actually the 15 years here? How was our way? And as you can see, the road sign clearly shows we've had a clear direction. And that is actually what I wanted to bring in now and bring it into the time of COVID. And the road was not very straight, but we had a clear direction. So let's go and try to do this exercise. And just remember the first take-home message. On the road to success, there are no shortcuts. As you can see, this is the experience that this driver made. But I'm pretty sure you also have made this experience, and the Swiss School of Public Health has also had this experience. But we didn't land like this driver because we didn't want to make road shortcuts. We wanted to move straight ahead. So now we move on. So the topic is given, the challenges in public health and global health. Some of you have already heard some of these aspects. We talk about transitions and neglect. We'll talk about systemic approaches, and then actually we ask the question, and then SARS-CoV-19 arrives. So what now? What now? How do we go on? And actually that's where I would like to, that you continuously start thinking, is this relevant for our public health thinking? And how, on the other hand, in the iterative process, how is this relevant for tackling the COVID-19 crisis? This is a slide, and as I said, that some of you with some small modifications have seen that one. It is actually all what we said already at the beginning when we got together as a Swiss School of Public Health, and some of us even before. We have actually to face these 9 issues, and actually it's the changes. I mean, we were not sitting there and said that's public health and that's how we move. We have actually to be constantly aware of changes, demographic, epidemiological, ecological patterns. And just to start the exercise, this is actually very much the case also now in the COVID situation, where we tend, as you see in the discussion, even in the press, that people many times just start still where we were in February, but we are actually not looking at dynamics and changes, and therefore we miss some of the point on changing strategies. We have to really look at people, to listen to people, and I think this is also something which you have seen in the recent discussion. We have had a lot of specialists, so-called, talking together, but listening really to those concerned are an important issue, particularly in such a crisis like that, like the COVID. Now, the system thinking is a challenge that we outlined a long time for us. And the system thinking is something which we not only outlined because we thought it is an interesting thought, but it is actually that we can, in taking Switzerland, taking Europe, taking any country, we have heterogeneities that we have to tailor to the local settings. And there it helps us when we have a decentralized governance. We have actually the different players in the health sector that we need to bring together. Jump today in the situation on how we try to solve the COVID crisis. We are now away from having a national guideline principle, but we are decentralizing it to the cantons and hoping that with the same basic public health concept, people would tailor measures to the local settings, to cantons, to region. How to finance is an issue that is not only an overall public health issue, but when you think of how do we really pay for the situation where we ask people to go into quarantine and so on, this is really something which is also nowadays important. Surveillance response, I will come to that one, that we are moving away from monitoring and evaluation, but in when we have to look for the benefit of the people, then we actually, the spirit of monitoring as surveillance is very important, so that we can quickly act, linked to the previous points, in tailoring issues. I don't have to point out the bridge to the current situation in COVID. This is actually one of the key issues. We use technology, and we have to think about that one, not just to go to seminars on digitalization, but really to really see how what we have at hand, and not what we dream of, we can most effectively use. We have to really respect the equity issues. We have to look at the human resources, the training and the continuing education, a central point of the Swiss School of Public Health, where I think we have done quite well. And we also have always, even in public health action, an important issue on research and development, in order to really thrive the agenda, solve the problems. So you see, this is a list of what we call the challenges for public and global health. And this list is not just something which we did a time before, but that was actually one of these guiding principles in our work, in our thinking, and how this now has become, as we already hinted on, important for the handling the corona crisis. And then we made the point, and this was also part of an earlier discussion, and deliberately earlier, to also go back to the roots, that we can think of many transition and changes, but some matter more than others. So the systems, the disease systems, not only the health systems, actually transition that changes. That is your well-known issue of demographic and epidemiological transitions. We don't go to that one. The environmental changes, the changes in how we look at issues. That is what I said before, that we go away from M&D to surveillance response, and actually that we have also the health systems changes, where it is the pluralism actually dominating. I remember very well at the beginning, when many of us started with working in public health, we were just seeing the public system in the center, and we were not really looking at pluralistic health systems, as well as also at the syncretism that can occur when different systems are brought together within a nation, within a region, to serve the people. Inequalities, technologies, and digitalization, massive changes that come. Because as we know, the inequality issues, actually with each intervention, we know from public health that we have to be clear that we do not create new inequalities. And if you really look at the press today, the corona crisis, you actually find basically every day a situation where people or people group correctly, or sometimes you wonder, indicate that an intervention, a restriction, actually leads to higher inequalities in our society. So these issues here, and I'm pretty sure everybody can have, Susan will distribute this presentation. These issues here are really the ones that have formed the backbone of our thinking and become now highly relevant when we try to tackle the corona crisis. So it's not that we have to invent new principles and strategies in public health for corona crisis. No, it's the other way around. We go back to these issues and try to go at them. And you see that we had at that time, we brought always in the challenges, these changes in disease patterns, the epidemiological transition. And we were actually having at that stage, when we actually showed this to people, we look at the green part, where we said, actually for us, the infectious diseases do not play anymore a major role. And now we are in a situation where this green, for the moment, as an epidemic and as a pandemic for most of the countries, gains more dimensions. And I think it is, as you can see in the discussion on how do we serve the population, the corona epidemic versus the underlying pattern of morbidity, it actually can create tensions, as you also could see. Now I come back to the, also remember what I want to do. I want to go back to what we saw as basic backbone for our work. And I take the yearly global burden of communicable diseases. And here in this situation, as you remember very well, we said, and this is deliberately the slide from about exactly 13 or 14 years ago, when we started with the Swiss School of Public Health. This is the burden in Dallas by HIV, malaria, and TB. And then we said we have a lot of other neglected diseases that are coming in. We are talking about communicable diseases. And if we add up all the yellow, we come to the red one. And actually, this is actually what is the number 2, all these so-called neglected diseases. And already at the time when we were faced with Ebola, not as a pandemic, but as a major outbreak in West Africa in 2014-15, people said, yeah, no, but you don't even have Ebola on this list. But this is so bad. And then actually one had always to show what is a disease in relation to the other in terms of burden to the community. And I think you remember very well at that stage, many people said, you know, you never invested in doing something against Ebola in terms of vaccine development. And then we said, you know, my friends, if you do not have even vaccines or better drugs against all these major burden, you would, even yourself, before Ebola turned up, you would not have made an investment to develop an Ebola vaccine. And it's the same here when people said, why didn't you not care for developing better tools for the coronaviruses before? I mean, it's very clear. We had so many other investments to make, also with limited resources, but massive ones that were actually more important with regard to the burden of disease in these countries. And this shows you a conflict sometimes in the priority setting of research and development, which we can handle if we see the overall priorities of burden where you would have to interact. And this priority setting and resource allocation is an issue that is also dominating the discussion now. And you remember very well this is situation we were mentioning, the emerging and re-emerging diseases. And at that time, and the Swiss School of Public Health was very conscious of that one, that there is one important thing instead of just having SARS-1 and SARS-2 and Ebola and swine flu. It is the key word here is that we have zoonotic diseases, and we have actually these zoonoses where animals are involved as reservoirs, and we discussed there the concept of One Health, but also that we have others like trypanosomiasis, dengue, buruli, and so on, and these are emerging because
Marcel, you've gone on mute. Your microphone is on mute at the moment. I'm trying to unmute you.
it happened from your end.
I'm not sure why, but we hear you again.
Yes, yes, but it came from your end that the host wanted me to mute, yeah. So that so we have actually these neglected diseases as another group where the environment plays a role, that they come up, the social and political changes with trypanosomiasis. And I think these are issues, two key issues: environmental changes, social political changes, as well as zoonotic, which are the issue that we have often forget also when we are discussing COVID at the moment. So please also think, when you talk about also COVID, but about the whole problem of neglected disease, emerging disease, it's never a disease alone. It's neglected diseases, neglected people, and neglected health and social systems. And the fact, again, to underline, from 1,400 pathogens, 800 cross the barrier between animals and humans. And all this made it at that time, and still now, I believe, I hope it is the issue of our Swiss School of Public Health, that we are actually keep high the system thinking, because we understand, with all what I try to understand, to show now, that if you are going only at the components, then of course you are actually reductionist and you only look at parts. But you look at systems, you look at interrelations and dynamics. You see systems, interrelation and dynamics, they are solution driven and synthetic and have, and that's important, time and space sensitivity. Look at the COVID situation right now. It's not Switzerland that has 300 cases, it's the distribution, how they are distributed in space and time. So time sensitivity and space sensitivity in system thinking is very important to correctly intervene, not only for Corona, but this is a basic principle that we should bring in public health. I have another line here around Swiss School of Public Health on top. You see, the system thinking has one thing that some of you know that I was never happy with. And this is actually, it's a Swiss School of Public Health. And then comes this plus, which actually is only a Swiss cross. It's not the plus. It's this plus that I always wanted to throw away, but I didn't manage to do that because it shows economics. But you know, the Swiss School of Public Health that does not do economics is not a good public health. Public health without economic dimension is a lousy public health. That's why we don't need this plus. So I hope now in the future this plus mutes to or goes over to a Swiss cross, and then I can be partly happy again. This is not just a joke, but it has to do with this system thinking, with really getting at a solution-driven public health, and that helps us to really do value for the society. Then now you got start to yawn because you think this you have seen now many times. I bring it because we have guided our work in the Swiss School of Public Health always with trying not just to be efficacious in our tools, but really to carry tools to the people. So really this chain, as you know very well, from efficacy to effectiveness, it's always the same. And it comes now that this is of course all systems factors and partnership, how we work together. If we don't work together very well, this efficacy, even if high, collapses to some low figure. You can make your own example. And if you just look at figures and you don't look at distribution, you are not equity effective. This is very relevant these days for handling a crisis of Corona. If we are only talking, and those who are thinking with the vaccine everything is solved, or if you think of another intervention, if you do not see the chain of a mask discussion, how much is efficacious is a mask? It's not so much only the mask and its efficacious, it's the behavior on how we actually handle masks. This gives the effectiveness and the community effectiveness. So this old slide where you start yawning by seeing it again is actually very important when you analyze what is happening these days in how a country, how a region handles the corona crisis. Here the things come together, and then you also realize that maybe my remark on good public health is always with economics from before is absolutely crucial to be effective for the benefit of a population. So comes Corona now, and this is how it came to us. And people were mainly looking at doubling time. This deliberately taken an early figure where we got all these countries with the doubling time, and some slowed down like South Korea here on this Italy, and Italy went up, and Switzerland went up, and Spain went up, and the virus is here. And sometimes I must honestly say, not in the emergency, in the intensive care, but in the public health strategy, people were more fixed by these curves than with the principles that I tried to show before. People were actually also fixed very much with monitoring. This is just a snapshot of the reproductive rate, how it is presented nowadays, continuously followed. Here is the famous line of 1. This is a screenshot. That's why it's not an elaborate thing, deliberately a screenshot. You can every day, you can really look at the references given, and then you see the new cases, and you see the effective reproduction rate presented. And the interesting thing here is that when the cases go down, and when you really are in a reproduction rate that is below 1, and you have very few cases, then the confidence intervals increase. That's why these shadowed parts, different, representing different figures, but the blue one is the one which is actually about how many people are infected by one infected person under the given control setting. Then you see we are above 1 again, and we are actually in a situation where we have a large confidence interval related to the lower numbers. Why do I show that? I show that because this is an important measure. We have all agreed in communicable disease control. But with what you have in the back of what we said before, this is not the only figure that can guide. Even if we have these figures for regions in a country, in regions in Switzerland, this can guide our measures. So how do we move on? I mean, this is the other point is, of course, the space. As I said before, we need to know where are the areas where we have more or less new cases. And this is a classical figure which you can also find on the website in order to show where the more hotter areas are and where more the lighter areas are. And this has to do, of course, with population density, with how people move and so on. But in an issue, and now we come actually to the next point, what is the strategy in such a situation? I tell you now very openly that it was very difficult initially to bring in the view, the public health view into the system, that we have to take into considerations this space and time relationship and really go back and not just say, of course, as I showed you in a short snap in June, we are actually having the basic measures which comes back to the 19th century when we realized from Semmelweis what hand washing can do, and this comes up now again in our approach. So this is the basic strategy: hand washing and distancing, as you know very well. I mean, don't go back to that one, but ahead of that, this cannot be the strategy that brings us back to normal. So this was the thing on one slide which made it difficult for some people to understand. It is the surveillance response that I mentioned before. If you just monitor and publish figures on a website or bring it in through the news, nobody actually understands what we really mean with that. What we really mean with that is we really do the surveillance, we test, and actually then we, after the testing, if cases, you know the strategy, we track contacts, contact tracing, we isolate cases, contacts go into quarantine. So this is the TTIQ, which, as you speak in English, it's tick, like the ticks that's stuck in your skin. For us, it is important, it's the tick that creates the backbone. And there, if you do this rapidly, not if you find contacts after 1 month, if you find it rapidly, you are able to really identify where transmission occurs, and you can tailor the packages. So this is the backbone, and you can actually tailor the packages, and you can have regional or even very local approaches depending on the nature of the transmission setting. And this is not just because this sounds nice that we do this. It is the idea of really avoiding that we have again a regional or a national lockdown. That's the issue of wave. As long as you can maintain the backbone with the tick, identifying and confining, you do not go into a second wave. If you are, however, no longer able to do the contact tracing, identify where this takes place, then you are taken, as you have experienced yourself when you sit on the beach, that the wave takes you under, out, or wherever. So it's very important that an issue that we have discussed a long time is also now applied in a coherent way in our situation. We have in our discussions in science, in the Swiss school, we have also in our dialogue with the Federal Office of Public Health, we have always identified surveillance response as important. And surveillance response is not only an issue of, let's say, infectious diseases. If you also have air pollution, surveillance response is also exactly in the same way relevant. Identify where it happens, try to confine this issue instead of just making one general statement. This you can make, but the action, the public health action, leads to really, or is based on surveillance response. So this is something that I like to take you home, but also to show you that we have actually discussed this. So surveillance response, a little bit easier shown, is that the brigade, fire brigade, goes only out where as soon as they see a small fire coming up, and they are not waiting until the fire is very big. So this is the simplified surveillance response situation. This can be a transmission of infectious diseases, can be air pollution, can be pesticide exposure, whatever. Surveillance response as a key public health action, research and action principle. And this avoids actually, and this you will see a lot this afternoon when we talk about the global one, when Erica, the center, will show what the global context will be, is actually that you are not just taking the big tool which destroys everything, also the economy and the social tissue. Therefore, I mean, this picture should be a picture that shows a targeted action at the identified places where the problem occurs, transmission occurs, avoids that we run into situations where we destroy much more than just work against a transmission of a virus. Living with the virus means that we are not following this picture. But it means actually that we have the appropriate tools. This, again, I like this picture very much, and that's why this is part of our backbone thinking since all the time that Swiss School of Public Health was in place, that we have the right tools. This man doesn't have the right tool to knock down this tree, and it shows you that he rather protects the tree because he has not the right tool. So the point to reach effectiveness, as we said, we must have the adequate, appropriate, and accepted tools. Think about how the discussion now goes on with the masks. It may be the question of how adequate and appropriate they are. All these issues are there. The processes, and important also, the tools is not just the tools, but the process. Take this picture again. Who has which role, which responsibility, which are the steps to take? And then, of course, always the legal and ethical dimension of it. Whenever you use a tool, you run into legal and ethical issues, as you could see with the Swiss COVID app, the TTIQ technology, which first was actually questions with regards to data safety, privacy, and data transfers. And here we have an enormous accumulation of these issues of a right tool in this corona crisis. A lot of good ideas, but we must get the appropriate, adequate, and also population accepted tools correctly into the process of public health action. So keep this picture related to each situation and not only to corona now. And then you have an important guiding principles on how we can reach effectiveness for our population. I discovered that slide a long time ago when I talked about urban development, and then you say, what the hell does he bring now urban development with living with SARS-2? You know, Jorge Hartoy, who unfortunately died quite time ago, made this statement where government policies become rooted in making best use of local skills, knowledge, culture, and resources. This requires that governments turn to the capacity of the people, who are already the most active city builders. That was about urban. Individual citizens and the community organization they form. This was actually a key to urban development. Still a lot needs to be done in Latin America, but we have taken this also in our work in Africa. Nowadays, for SARS-2, COVID, this is equally important, because we observe, and I was just having, on Saturday, I was in an alternative World Economic Forum in Davos, and there people actually complained, besides other things, they complained that we would not do, we as a state would not do it very well, is listening to people. And I think this is something not to give always a go to those few people who were in Davos. No, it was a sign that in many of the issues here in the corona crisis, we have sometimes not enough listened to people and worked with people. That means creative listening. Actually, the creative listening reveals society and the socio-political anatomy. And the key issue there is, where actually Susan should talk, not me, is that actually here communication plays an important role. We have very much brought into the thinking of handling COVID by really insisting that communication is the responsibility of everybody, not just the government says what we do, and that we actually combine the sensitivity for communication with Jorge Hartoy's point on how we reach people. The approaches to do that, the tools, is not just to run around and do a few interviews, but there is very well documented, which is coming from the French side more, in Recherche Action Formation, which is in English participatory action research. But this is this type that actually not only involves people, but also reveals what may be new ways of bringing interventions, making them appropriate, adequate, and mainly accepted. I had 10 years ago in Lugano a plenary lecture we were actually asking which are the burning issues, I was asked. And I just came back from the Pacific, and I was on Mount Yasur in Vanuatu on Tanna Island. And there, this Mount Yasur is very interesting because here you can go up and look at really the hot spots. The hot spots of a volcano is actually the eye of a volcano. You can go there very close, and every 3 minutes, the actually lava is thrown up with huge eruption, and at night, this is a spectacular scene. And so looking at these hotspots actually are very important. You look at this, is very beautiful. And now what does come out for us? And I really use this many times. It's actually understand what makes us effective or not effective. This is this graph on top, which you have seen and you're maybe tired of. But the hotspot in understanding and handling public health is to understand what are the determinants that make up effectiveness. To understand what actually make people use services, accept services. And that is actually very often the quality of care and the quality of services. And very often the major determinant is the perceived quality of care. This is again linked to the creative listening and the communication issue. And as enough discussed, the other hotspot and eye to really look at is the surveillance response. If we get these hotspots and we look into the eye of the volcano and into the eye of the hotspots of public health, I'm pretty sure we get it. The other thing actually what I like to get on is, which we see also, is we should be less academic and more humble and pragmatic. This guy does a huge job, has a huge rock to hold. And he waits and waits and waits until things happen. And some of the scientists have this behavior. They look more and study and analyze and say always at the end of the paper, more research is required or so. But I remember here very well, and this is also important for handling a crisis. All scientific work is incomplete. All work is liable to upset or modify knowledge. And that is important, that that's not confirmed to us a freedom to ignore the knowledge that we already have or to postpone the action that it appears to demand at a given time. That's what Sir Bradford Hill said in 1965 when he was attacked about his studies on lung cancer and smoking. This is also relevant today when you ask as a scientific task force, as the Swiss School of Public Health network that inspires the scientific knowledge for our federal council, we always must say what we know. We always must say what we don't know. But the ethical thing is also that you still can, with what you know, still do something and not just wait and say more research is warranted. This is what I want to give you home. And of course, we come to Lugano where we should be to have the party afterwards. This is a famous Lugano. This slide I have also shown several times, that our view in global health, in public health is, you know, Lugano disappears because of all these labels of organizations, NGOs, government organizations, initiatives, consortia, platforms, or whatever these things are called. And I don't want to destroy the good intention, but what we see also now with COVID, what we have predicted a long time before, it is actually, we must have more effective partnerships through better defined roles and responsibility. One misery why we do not, and I mentioned it with the effectiveness story, that we do not achieve effectiveness is very often that we isolate, we work in isolation, and we have not well defined who is responsible for what at what level. And I see here also an important hotspot, an important way forward in our work. So please, my dear friends, always my boat. I like this boat. Don't give up, the guy tells us. And I thank you so much for listening and for this process of mutual learning for change. I brought all the things together that you have all inspired me to think about. I just made a summary of what we have done together. Thank you very much, my friends.
Thank you very much, Marcel. Brilliant as usual and so stimulating. You've actually given also a little bit of promotion, although you may not have realized it, for 2 other activities we have this week. So Monday through Wednesday, we have a course in community-based participatory methods, where we've got students and participants learning about those methods that you had inferred a moment ago. And also the Wednesday evening plenary at 5 o'clock is community engagement, where Dr. Amalia Pisantes from Lima, Peru is going to talk to us about engaging communities and how to listen well. So with that said, I'd like to turn it over to some questions. And if you all have questions for Professor Tanner, you can enter those into the Q&A feature of the Zoom chat. And here with me is Professor Nino Künzli, who's the current Dean of the Swiss School of Public Health, the SSPH, and he and I will read those to Marcel. So if you have any questions, just let us know and we'll read those over to Marcel.
Mm-hmm. Well, Marcel, good morning. I'm Nino speaking. It's fantastic. Thanks a lot.
You're on mute.
I'm muted.
You're on mute.
I hear you. I hear you.
Marcel, do you hear me now? I'm unmuted. Thank you very much, Marcel. I would like to raise one question. Marcel, do you hear me?
No, now it's going off again. I don't know what is
happening. Marcel, did you hear me?
Yes, just the beginning only, yeah.
Marcel, do you hear me?
Now I hear you.
Okay, great. Because Susan and me, we share the room.
Yeah, this one should stop, otherwise it gives an echo, you see.
Susan will stop the microphone.
I'm trying.
Marcel, I have a question.
I can't. The button doesn't work. Sorry.
You should mute your end.
I'm trying. It won't let me.
Or you go to the same screen next to each other, and then you have one microphone.
Go ahead.
So I try now. Do you have an echo?
Marcel, is it working well?
Yes, for me it's okay. Huh?
Okay. Following question. I like your effectiveness story. Actually, it visualizes very well that we talk about a continuum of probabilities rather than this yes/no. And I think in the COVID crisis we have seen a lot of problems with yes/no answers versus dealing with probabilities and the continuum. And I wonder, the masks was such an issue where we had this no yes about masks, and later on we have now this question whether or not to promote community masks, which, as we all know, the self-made non-disposable masks are less protective than the good ones, but they are better than nothing. So my question is to you, how would you deal on this continuum of doing the right thing? Why don't we promote these community masks? Should it be done, or would that harm the epidemic more? Actually, some countries have promoted those. They are cheaper, more accessible for people. You can reuse them. So what do you think? What's the reason of the hesitation we see, for example, in Switzerland and in other countries, in dealing with this as an option?
And that's a very specific question. Thank you very much, Nino. I think the mask is a very good example for this effectiveness continuum. That you can do your own examples and do your issues. I mean, you will, the task force has never actually worked against the community mask. We have actually even said, basically everybody should have 3 masks, just community mask, one that he or she wears, one mask that actually is in the washing process, and one mask that is the reserve. So with 3 masks like that one, you can handle the situation. And if you would put this onto this effectiveness, you would have maybe some other of stairs. You would actually see that maybe the efficacy is only 50%, But if you have a high compliance where people comply because it's their own mask and so on, you still have actually an effectiveness that is acceptable. Instead of having a mask that has an 80% effectiveness, efficacy, but actually has a low compliance because people say, I don't wear these surgery masks, I don't wear, because they are not hygienic, they don't hold very well, I want my own mask, and so on. So this is a very good example. But I brought it in because this is really truly an issue for many of the interventions, that we create, as you also say, a false dichotomy. You know, people are always discussing, is it good or not? This is stupidity. Actually, one should see it on this continuum. What can contribute, not as a single tool, but in the combination to effectively really do intervention. That's why also surveillance response, not to do everything for the same thing for Switzerland. I mean, if you're asking now for masks in shops, if you have in the central part of Switzerland, in the Schachental, in the canton of Uri, a small village shop, it's not the same thing as you have the supermarket here in Basel that is on Friday evening, on Saturday morning crowded. And I think these are the things which is this confinement, this tailoring to a setting is absolutely key. It gives more confusions because it's decentralized, it's the canton, it's our federalism, but effectiveness maybe is much higher than to have a whole of Switzerland saying these masks are, oh, halfway, I hardly have them. Wear them where they are useful. And that is actually the way how we move, not only with Corona.
Thank you, Marcel. That's great. Actually, I see a question from in the audience, Sergei Romanchka. Marcel, you are well known not only as a wonderful authority in the field, but you have this positive attitude. And I think this is a question for you. Do you have an example, a positive example, a good example where you would say this is an example for very good or perfect collaboration across different organizations, across different sectors or countries or counties, whatever. A good example where we could show.
We have many. We have many. I didn't show that we don't have, but we can a lot of improvement. I mean, in my whole history and over 40 years with Africa, the best achievements that we have made, for instance, in the field of bed nets, in the field of malaria vaccine, in the field of new interventions, community-based, I have made wonderful experience in situations where mainly you have decentralization. So what people say, it's complicated, but it has helped in also the Ebola situation. You have very good collaborations that actually helped at the peripheral level to bring together the players. And what is actually the good example is when you go in a lot of efforts that we made is actually the so-called district health plans, in a way that we have all activities, be it from a charity, from an NGO, be it from the government, placed in a plan, and then actually you see how we can solve things together. What is difficult if in a situation people just rush in with an intervention and want to do some good and don't see what is already there or the system that is already there. But my 40 years of public health experience, it was always carried by many good examples. That's why I'm still there and I'm still happy. I mean, if you want an example where I also believed it was very good initially, was actually in Switzerland, in the canton of Basel-Stadt and Basel-Land, when we tried to bring the university hospitals together. I mean, all the planning was carried by a very good spirit. That actually one canton and one party in a canton was voting against it or getting the referendum against it. That was just a bad incident. But the experience on thinking about not a canton, a hospital, but about a service region like northwestern Switzerland, that was for me a good experience.
Thank you, Marcel. I see Michael. I mean, we're almost running out of time, and Susan is telling me her system is a bit weak now. But there's more question. I have a question of Michael. He has actually two, but let me emphasize the second one. What about the global response influencing the national response? How would you evaluate that in the COVID crisis?
I mean, the global response is always, we cannot live on an island isolated. And I think it's very clear that we are influenced by what we would call more difficult actions that are taken in some countries versus others. But I mean, the important thing is that we look what is happening, and particularly when it comes to cross-border, opening borders again, we must find a way on working with France, Italy, Germany, and Austria, and therefore some also confusion was initially created. But if we remain firm that we keep the surveillance response approach, for instance, or if we would keep firm that we do actually herd immunity approach or the Swedish model in inverted commas, that is actually very important. What you can't do is just pick a strategic component from one or the other place, and that we have so far not done. Some people are now forgetting that we have this surveillance response, this confinement, identifying early where where transmission happens, and then targeted intervention. This actually, you must remain firm. This has so far worked. If this will work for the next half year or so, I don't know, but I hope so very much. Remain coherent with your strategy, but be ready to adjust it, of course.
Thanks, Marcel. I see Tanya Bart. It's probably the last question we have time to raise. Tanya is interested in a very specific quarantine question for Switzerland. So what is the reason why younger school children are not supposed to go in quarantine, although they are close contacts? I understand they are not the drivers of the epidemic, but they still can carry the virus and infect others.
Yeah, that's true. And I think here I just can say it's in our policy briefs on that one. This is really, this is very clearly explained, also scientific evidence. Children up to surely 12 years around are not the drivers of the epidemics. And therefore, actually, we are, when you look at the children are infected mainly by adults, and it's not the children that are really spreading in schools and so on. And I think this is really an issue. The older ones, the adolescents and the young adults, therefore we have a little bit other measures for those recommended, and they are more or less in place, are different. Yeah. I deliberately, I mean, these are so many questions that we could still discuss, but you know, I deliberately did not go to specific issues on the quarantine and these details. I just wanted to show you how actually, and this is maybe also a sort of a closure part, is what we have actually set as a backbone of our Swiss School of Public Health in terms of strategies and concepts actually has gone through this a little bit winded way of 15 years, and that we bring into our all other partner institutions. And this is actually extremely relevant when we have to tackle now the corona crisis, and not the other way around. You know, it's not the crisis that now determines strategies, but we must come from our systemic approach into and handle this the crisis. And I think here, with the question of the other countries is sometimes a little bit difficult. That here you see, if you do comparative analysis, that many countries have been, particularly at the beginning, a little bit picking left, right, and center. And that's the value to have a Swiss School of Public Health, that we have a backbone on which we can build. Not to say we know it in a bulldozer way, but we can build on that in order to handle more effectively such difficult situations.
Thank you, Marcel. Before handing over to Suzanne,
I hand over to Susan. We have echo now. No, it works. Thanks a lot, Marcel. I want to hand over to Susan, but I can say something she cannot say. I would like to thank both of you very much for the great work you do in the task force. This task force is wonderful, and everybody online, please, if you haven't checked out, they write fantastic policy briefs. This is excellent, and we very much appreciate everybody who contributes actually to the task force, which, as many know, is a voluntary, huge job. So thanks, Marcel. Thanks, Susan. You served there as well. And I hand over to you to finish this first plenary of today. Thank you.
Thank you very much, Nino. If you can mute your side now. Sorry for the technical difficulties, everyone. As it's our first experience doing this fully online, there are a few glitches. So thank you so much for your patience. But we have managed to do well. We had 140 people participating at one point here in Zoom and another 11 on YouTube. I wanted to just stress that we had one more question in the Q&A box that we won't elaborate on, but it again stresses what Marcel has been talking about today, and that is the need for local and contextual-based solutions. And one of our colleagues here, Lawrence Lewis, had even mentioned that in the chat, and that is that we're kind of copying and pasting things into other countries without contextualizing the response. And as he mentions here, that can do even more harm than good. So let's talk about this as the rest of the week continues. We have another plenary session at 5 p.m. Swiss time from Erica Placetta, who's going to talk about the SDC response. And we'll continue this as we move along. Thank you very much, everyone, for joining us this morning on our first ever plenary that's been online. And I look forward to seeing you in the following plenaries. We have 9 more every day, 5 o'clock in the evening, and every morning at 9 o'clock in the morning, also streamed live on YouTube. Thank you very much. Those of you who are participating in courses, I wish you a great day. Everyone else, have a fantastic day, and we'll see you again this evening. Bye-bye.
Bye-bye. Thank you very much, everybody. Bye-bye. Bye-bye.